what is EEG or electroencephalogram? So EEG or electroencephalogram is a test that detects the brain electrical activity or brain waves, and we do it by putting wires on the head, on the scalp, and then these wires are connected with a device that detects these brain waves, and then we read it on the screen, and then we can tell if somebody has seizures or epilepsy. And the EEG test is a unique test that tells us the brain electricity, and in epilepsy we will see higher electricity in some areas of the brain or in all over the brain. It can tell us like what type of epilepsy the patient has and where is it coming from, and it can help make the diagnosis of epilepsy or confirm it. However, the EEG test needs to be, there are lots of criteria for it. First, it has to be done during sleep and wakefulness, so it is better to be sleep deprived so that you can sleep during the EEG. Second, it is better to be read by somebody who is experienced in reading EEGs and trained for that, because there are some nuisances in EEG that looks like abnormal, but it is normal, or sometimes abnormalities that are looking like normal. So it is important to have a good experience with reading the EEG. And then the third thing is that the length of EEG is very, very important. Sometimes the brain waves can be normal in patients with epilepsy if they are like 30 minutes. So if you repeat the test multiple times, or if you do long 8 hours or 24 hours, that increases the chances of capturing anything abnormal. And yes, EEG can be normal and somebody has epilepsy because the source can be small or deep in the brain, or it can be just as simple as the discharge does not happen during the EEG recording.